This learning series is sponsored by Casey Family Programs in partnership with Implematics and CDSS, and it's hosted by Caltrin. It's intended to assist counties in preparing for implementation of their unique comprehensive prevention plan, their CPP. This series maps directly to the 9 readiness domains for California's Family First Prevention Services, that's FFPS program, and addresses requirements outlined in all county letter ACL 2223 and AB 153. So this is, well, a couple months now. I wish I knew exactly what number we were on, but we've done a couple. We've gone through quite a few topics with Q&As to follow after each one. And at the end of this, we're going to talk about the last opportunity to jump into the learning series. And like I said, you can always watch anything that you missed on the Caltrin website. We've housed all of the learning recordings and resources in one centralized area. There's also a separate resources area that houses all the different maybe references that you hear frequently. That's there as well. I believe my next screen, if you would advance me, please. Thank you. So I'll make one more mention actually before I pass it off for panelists. And the one mention I want to make is the last and final learning forum prior to the January 2023 deadline for the Comprehensive Prevention Plan is going to focus on strategies for drafting the CPP. It's called Putting It All Together. And it's going to be talking about not just strategies for drafting the CPP, but executing an internal review cycle, capturing and incorporating feedback. This particular session will also address how to develop a CPP that facilitates and supports implementation and readiness. So I want to let you know that you can sign up to attend. You can definitely do that in the chat. The November 16th Learning Forum will be recorded, but there will not be a follow-up Q&A session. So with that, I'd like to pass this conversation off to our moderator, Kush Cooper. You would have met Kush in the first session, so where you came here from. I just want to give you a quick reminder in case you caught this Q&A and didn't attend the main session. Kush is an adjunct professor at the UCLA Luskin School of Public Affairs, as well as the CEO of Implematics, a consulting firm serving public and private organizations in the area of foster care reform, LGBTQ youth in systems, implementation science, and leadership development. So with that, Kush, I'll pass it off to you to introduce our panelists.
Thank you. Good morning, everyone. So our panelists today are the panelists that spoke. They were the speakers at our Workforce Development Learning Forum. They are Dr. Dan Edwards, who's a licensed clinical psychologist and a nationally used technical assistant consultant for evidence-based practices. Jennifer Rolls-Royce is not going to be here today. So we will have Caltrin answering questions on her behalf, but she's the director of the California Evidence-Based Clearinghouse and Caltrin, which is housed at the Rady Children's Hospital in San Diego. And last but not least, Kelly Winston, who is the chief of the Family Centered Safety and Support Bureau at CDSS, and has been that bureau is instrumental in creating the resources, developing the plan to the Administration for Children and Families, and Kelly's been a great partner, interacting with us through all of that. All right, so then I am going to. So one of the things I do want to mention before we get going into before we get into the questions, is that we're gonna do our best to stick to the workforce development topic, and not drift into the things that folks have anxiety about. I know there are questions about services and questions about funding. We're gonna try and stay focused today. To the degree that those topics are adjunct to funding, adjunct to training and workforce development, we'll answer them. But just a warning that I will keep us on track. If you do have, and partially, we have the panelists here with the experience they have. So we don't want to throw any curveballs at them. If you have questions on the other topics, send them to the CDSS FFPSA mailbox, or contract your lead TA support agency. And there's going to be some links as to how you can do that. You can browse the resources that we've provided that Jess talked about. Encourage you to explore the collection. There's everything you need is there. You may not know where to start, and may need a conversation or two with those that support you to figure that out. But everything you need to get your CPP in is there. Right? So looking, no messages from my team. Let's get into the questions. Okay, so these came from the Learning Forum and the Q and the registration for this Q&A. And the first question is about prevention mindset. The question was, we need to build systems thinking, collective impact capacity to shift mindset. It's not as easy to do with a one and done training. How do you suggest we do this? So, Dana and Jess at Caltrin, you all have, you did the Reimagining Prevention series. You have been training in the primary prevention space for a while, particularly because I suspect, given all your work in child abuse prevention, that we know that primary prevention provides us the biggest bang for our buck down the road. So how would you answer this question, what you're seeing, given the conversations you have in this space?
Sure. I can start with that. And then if Dina has anything to add or any of the other panelists. So, to the person that asked the question, you're right. It's not as easy as a one and done training, but what really is, right? I feel like this type of mindset shift, or in some cases, a culture shift within an organization towards prevention, takes revisiting. But I'll give you an example, actually, that I heard from a participant after our reimagining conversation. This person was in probation, and they said, what was helpful about revisiting the story about moving a team upstream? I always kind of considered myself at the end of the stream, right? My goal was to catch people that had fallen in the river. And I'm referring to a story that you would have seen in the main session. The idea that my role is tertiary in nature, I catch people as they come down the river. I've always seen that as being like my role. And I never considered that I can actually move upstream and make impact further, kind of earlier in the process. And I think when they told me that, they said, what was helpful was to revisit the framework, the OCAP framework, which we mentioned in the main session, and kind of asking myself, how do I intersect with opportunities to provide primary prevention? What would that even look like if I could do that? And I feel like it's that idea of asking a team to look at the framework, see themselves in it, ask questions, but it's not a one-time conversation. I think it's integrating it, it's collaborative, it's not just bringing information to your workforce, but having them analyze it and apply it to themselves. I would say that's been the most effective that I've seen people talk about so far. Dana, is there anything you want to add to that?
I would think along the same frame of mind, which is when we're talking about, in this question, shifting mindset and systems thinking, we're also talking about culture shift. And so there is that need to, one, consider your whole workforce. So today we're probably going to focus a lot on evidence-based practices. So we're going to focus on people who are delivering services. But when we're talking about shifting mindset, we're talking about everybody in the system. And so particularly now that we're looking at cross-sector work, really taking a look at that full picture of who does that include, and making sure that they're getting those messages about shifting upstream and working in primary prevention, but not getting them just once. Like an email blast is not going to do it here. And so making sure that there's a consistent communications plan around what we want people to be building culture around. And I think going back to a couple of documents, one is your own plan. I think there's a real temptation when you put in a lot of effort into a document like this, at the end to be like, we're done. But actually, we're started, right? This is a document that will need to be a living document that people will need to refer to, go back to, use routinely, and ideally tie back to things like the state prevention plan, which really spells out very neatly some of the core components that we're aiming for here around addressing disproportionality, around building in mechanisms for authentic community engagement, and doing that greater piece of work than just completing the plan. In terms of actual systems resources, I know that everybody keeps hearing it, but I'm going to point people back to that collection of resources, both that CDSS has and that we have on our website, on the Comprehensive Prevention Planning website. There's a suite of tools, a number of suites of tools actually. So really you can find a set that's going to be evidence-based, but that is also going to meet your planning team's needs. So if one doesn't look like it works for you, maybe it's not right-sized, there's likely another set there. There's some redundancy built into that collection.
Great. Thank you, Dana. Thank you, Jess. You know, and I'll add something from looking for my role as a professor. So I have 22 MSW, Masters of Social Work students in my child welfare policy class this quarter. And of the 22, 0 had a conversation about prevention before my class. And so that's one place, right, where we can start to make our shifts en masse, start to get the conversations about primary prevention into to our students, into academia. So that start before they get into practice and then have to unlearn something. The other thing I would add is that for my work with counties, and in the implementation work, we look from where we're standing. So if you're standing in tertiary prevention and looking from there, the gravitational center of everything you do is going to be tertiary prevention. You may inch up into secondary. You may even have resources left over to inch into primary, right? But it becomes an afterthought. If you actually, like, literally get up out of the chair you're sitting in the tertiary side of things and move and re-anchor in primary and look from there, start implementing your services at the primary level, not at the level where we're most comfortable tinkering, which is, making the system less difficult, right? That's not even tertiary prevention. That's actually quaternary prevention. So it's about releasing some of our discomfort and just re-anchoring in primary prevention. Perhaps when you start to implement your service arrays, right? Perhaps you might start there rather than where we usually start, which is let's start in tertiary and see if we can inch a little bit upstream. Right. Let's move to the next question. Kelly, this one's for you. Could you provide some more specifics on how safety and risk monitoring needs to be done on all levels? Folks are looking for more information to determine what training might look like, particularly for those counties that are going to elect to have a community pathway, which, just as a recap, is a pathway to services that has as least contact with the system, the child welfare probation system, as possible.
Sure. So I want to just start by sharing, some of the elements that we talked about in the series last time. So I mentioned that we do have a curriculum that will be developed to address these things. So that's something that folks can look forward to in terms of getting more of the detail. In the meantime, the next thing you all can look forward to is a new version of the state's prevention plan, which will give a more detailed overview of the different tiers available. And the tier 2 foundational part of that training plan will provide a little bit more information about what that is expected to look like. Although having said that, that'll be kind of an overview for what will come out in the curriculum that we're working to develop right now. So for the Title IV-E pathway, we're really relying on those existing protocols. So for child welfare, that's your safety monitoring and risk assessments done through SDM, your regular monthly visits, those types of activities that are already in place that are then enhanced by the opportunity to provide these Title IV-E prevention services. So through the supports and the tools that are available in those services and those existing protocols, we have sort of an enhanced version of safety and risk monitoring. That will be bolstered more by additional training and that concept of really identifying those safety and risk monitoring protocols in this new framework of Title IV-E prevention services. Then in the community pathway, this is where our curriculum development really needs to address how this process will work. This is a new area for us, so something that we're going to have to be really thinking through in that curriculum development process. And I mentioned in the learning series last time that we want to make sure that folks have an opportunity to participate in some of that work. And so there will be reach out from the state and from the entities developing that curriculum to help provide those opportunities. But we really want to leverage that community approach, that idea that the services available through the community pathway are really intended to support the family. Those same service providers and case managers in the community pathway will be trained to assess safety, to do that ongoing risk monitoring. And then, and really just, that's where we want that, whether it's safety planning that needs to be done or something like that, we want that addressed in that community pathway. And then we are going to additionally leverage existing mandated reporter protocols, but those staff involved in the community pathway will have enhanced training around really making sure that they've already used a lot of those techniques that are available through their existing services before we get to a mandated reporter call. But it would be a collaboration between the community agency and the Title IV agency once that mandated reporter call happens. So that's what we expect to see in curriculum development. And you'll see more to come as those that thinking and those processes and your voice in that process is developed.
Great, thank you, Kelly. I have one more for you. This is one that we've been hearing a lot also in the work I do. Are counties required to implement all 10 EBPs? So that's the first part of the question. Why don't you go ahead and answer that, and I'll give you the second part. So do we have to do all 10 EBPs in the state's plan?
No. The simple answer
short
is
answer.
no. Yeah. But we want you to include an EBP. Include as many EBPs as you like, but not all 10 are required.
And then can you fund other things than the 10 EBPs?
Yes, absolutely. So the state block grant funding gives you an opportunity to really include any primary, secondary, or tertiary service outside of the prevention clearinghouse. We have the 10 EBPs included in the plan. Those are the 10 that we believe will be 4E eligible, but state block grant funds and other OCAP funding sources can be used to fund those other services.
And they could use the state block grant to fund the EBP until they are able,
correct.
Is that right, Carrie? Until the automation is ready to do child-specific 4E claiming.
Yes, absolutely. Until automation is available and Title IV claiming can occur, you can use state block grants for any of the services included in the prevention plan.
Great, thank you. Looking in the chat to see if there's any follow-up questions with regard to anything we've discussed, the mindset, safety and risk monitoring training, or EBP training. All right. Okay, seeing none for now, Kelly, while I have you, there are 44 folks on the call today. And those they will likely be the first in their organizations to know that the CPP template was posted yesterday afternoon. So could you just share a little bit of with folks about where it is, and I'm happy to scroll through it if you'd like.
Sure, if you want to pull it up on your screen, that would be
Sure.
great. So many of you have been asking about the comprehensive prevention plan template. So we did release that yesterday via email blast. And then it will be posted on the website. I understand it was up yesterday and there's something wrong with the link. So if you can't get to it today, know that we're working on correcting that. But the template is really intended to identify, what are the primary requirements for fulfilling state expectations for the comprehensive prevention plan. It's not a required template, so you don't have to use it. You could use your own version, whatever you're using to communicate across your cross-sector collaborative might be a different format, and that's fine. But this gives you the basic requirements that you have to fulfill in order to achieve state approval. In addition to the template, there are assurances. It's a simple form that you would need to have your sort of trifecta of authorities sign. So that's your child welfare, your probation department, and your local behavioral health representative. Those individuals have to sign that assurance document. And it just basically says that you're, as a part of your prevention plan, you're willing to participate in the state processes that we're putting forth. Hopefully
that template is the assurances template is not available yet, right, Kelly? It'll be available shortly.
Yes, that's correct. So once you have your prevention plan done, and the assurances template is just being finalized for accessibility, and then it'll be posted as well, probably within the next week. And then once we have those available, if you complete those 2 documents and submit them to CDSS in January, then you're probably in pretty good shape.
Right. And just as I'll just sort of scroll through for folks. Again, we've had, learning, there's an implementation guide, and we've had learning forums in the order, in fact, of how things are showing up on this template. So I just want to, I'll scroll through. There's a governance structure piece. There's cross-sector collaboration piece, tribal consultation and collaboration. Kelly, it looks like these questions are prompting questions and not required to be filled out. Folks can just use them to think through what they're going to show you.
Yes, that's a good point. The questions were intended to help you think about what you would include in your plan. If you answer all of those questions, you're in pretty good shape. They're not all encompassing and they're not required, but they're good guiding questions.
May not apply. All questions may not apply to everyone either, I can imagine. Okay, so how are you going to integrate the core practice model? Okay, so this is your target population and their needs. The service array that you're going to bring to bear to meet those needs for that target population, primary, secondary, tertiary, what data you used, submitting your theory of change / logic model, your spending and sustainability plan. And there is, Kelly, I saw that there's a spending plan template, but that's not required either. Am I right?
That's correct. So in the email blast that went out yesterday, we did include a spending plan template. That template really is intended to help counties identify, all the different funding sources that they're going to be using for their comprehensive prevention plan. It's not a required template. It's something a tool for you to use if that's helpful to you. The template itself has an instructions page. It has some definitions. It has 2 different templates that you can use, one for planning and then one for service delivery. And then there are some examples that you can look at to give you an idea of how you might lay out your spending plan. Hopefully it'll be something that you can adapt or use, or it gives you some idea of how to do your own.
Thanks, Kelly. And then we just continue. And then this is the piece that Kelly, you were talking about with, here's the nature of the assurances. And here's just a little information on, when they're coming and where the assurance template will be. Right.
Thanks.
And
Chris.
I really like, Kelly, the logic, with which it's laid out. For example, you can't do a theory of change in a logic model until you know who your target population is and what the service array is, right? And so it comes after. So really, really helpful, and hopefully that will calm some anxieties that folks have. But if you've been looking at that implementation guide, it goes in this order too. So if you started to work on those items, all you need to do is document the work that you're doing. Add appendices to the appendices for the data you're looking at. Yeah, great, thank you. Okay, well, I am going to open the floor for questions directly from the audience. I see one, but there may be others. So I'll defer to our team to tell me which ones they have teed up to share.
Sure. So I think you saw one in the chat,
Okay.
and I'll read it out loud for you.
Great.
Before it was said that once the state plan is approved, that we could claim reimbursement for training and administrative costs. Does that include training costs for implementing the EBPs our county has selected to use?
I'll go ahead and answer that,
Yeah,
Kush.
great.
It does include that training. That is something that is Title IV reimbursable. And if you, I don't have the CFL handy to share with you, but you can look back at that and to identify the claimable costs. So as long as it's included in there, once the plan is approved, you will be able to go back and claim those costs. The back claim date is expected to be October of 2021, because that is when we were in compliance with Part 4, which was a prerequisite.
Thanks, Kelly. Other questions, and you're welcome to just raise your electronic hand, your physical hand, or put it in the chat.
Coach, can I just follow up on what Kelly said? Just a quick note about that from the perspective of somebody who's got their eye on evidence-based program implementation, nationally. There's a few other states that are starting to get into this stage, the actual, rubber meeting the road, so to speak. And one of the things that just reflecting on that question, I totally get it. We want to know, are training costs going to be covered? But I think one of the things we're learning in other states is that there's a real desire to, again, totally understandable, to start jumping in with training and thinking about how to get training out there. That's where the action is, but not doing the preliminary work, the kind of stuff that you've just been talking about, Kush, about really thinking through implementation strategies and governance and collaborative, tools and resources, make sure those are in place. So as I think about, 3 or 4 of the big issues that always come up, staffing, number one, workforce development is on everybody's mind, or just, being able to recruit and hire and train. You want to really take the time to think about what certifications are required for certain positions. It's a budget question, so forth and so on. Number 2, there's data issues and data infrastructure issues that have to be thought through, talked about, data sharing agreements, etc. And then I think a big one, which is really a problem in some other states right now, is what you talked about just now, Kush, identifying your target population and thinking about what's the referral, enrollment, engagement process, and how, if we stood up a PCIT program or a nurse family partnership or an MST, how would we make sure that we have an adequate number of appropriate referrals to that program to allow the provider to actually sustain the program over time. So that's I think you're, done a beautiful job of putting together a planning process. I just want to encourage people to pick up and look at each one of those steps.
Yeah, great point. Other questions? No, not seeing any in the chat, not seeing any hands. Right, in that case, we may have a briefer session than we originally anticipated.
I did see a quick
Is
one.
there a quick one that I missed?
Would it be possible to also link the implementation planning document that Dr. Cooper just referenced? I've seen it, but had trouble finding it.
Oh, the implementation guide.
I dropped it.
Great.
That was
There's a
dropped.
link to that.
And then there's one more question.
And just as you before, on the implementation guide, something to always keep in mind is this is the version that gets you to implement your planning process that ends with the writing of a plan, right? You're not actually implementing your service array till after your plan is approved, right? So that's why it's the plan development phase implementation guide. Another one, which is kind of goes into more of the nitty gritty of implementation, laying down processes, referrals, data systems, etc. We'll talk about that next year.
And at the moment, those are all the questions that we have. Of course, we would encourage anyone, if you have questions, there was a great prompt in here as well, that if you have any current or anticipated challenges and you'd like to talk through those, feel free to raise your hand. We're happy to call on you, or you could drop them into the chat.
Nope, we have a hand.
Great.
Hector, please go ahead.
Thank you for taking my question. Dr. Kush, first challenge was finding the hand. So I just want to clarify the question that I put in the chat. So this is county conversation. This conversation is county initiated and driven to include the CBOs, not the other way around. Number one, question number one. Number two is, so we have pretty regular contacts with our county in trying to creatively collaborate in our community. It's a very collaborative county, but I'm the CBO coming into that conversation. I should say our agency is. And so we have an upcoming meeting. I'm curious if there's any quick pointers of some of what we're trying to figure out as a CBO is what services can we offer that we naturally can extend ourselves to provide, and if it's something that we currently don't do, but that it's close enough to what we do, and then extending that to the community to be able to fulfill this charge.
Great.
So 2 questions.
Yeah. So the first question was sort of what's a way that is this a county driven process? Hector, do I have that? Kelly, do you want to take a stab at answering that, and I'll add in some thoughts at the end?
Sure. I mean, I think the short answer is yes, it's county driven. But if you look at the state law, there are requirements for including entities that really need to be at the table, right? So we have required what we call the cross-sector collaboration. And because we have 58 different counties with 58 different structures and needs and that sort of thing, the expectation is for us to provide a collaborative or a flexible way in which they can do that. So it's going to look different in every county. What we've tried to do is really ensure that anybody who wants to be involved in that process, we're trying to connect them with the primary folks who are responsible at the county level. It sounds like you're connected, but we really want to make sure that that's true in every county. So that collaborative, it really just depends on the county and what that looks like. Some counties may be leveraging their interagency leadership teams through 2083 work, system of care work. It it just really depends.
No. You know, Hector, the way I think about it, sort of given the conversations that I'm having with folks locally, is that the problem we're trying to solve at the moment sits in the lap of child welfare or probation, right? The question we're asking is how can they support preventing folks from getting to them, right? So if you look at it that way, like they've got to ask the question, right? They've got to ask the question, and then you see, well, why are they getting to us? Well, they're getting to us because they were at risk and we didn't provide them service. Okay, great. Well, why didn't we provide them service? Well, their community doesn't have service, right? So you start to have these secondary and primary conversations as you start to ask the whys going back. So it is sort of their problem we're solving. However, the strategies to solve that problem, the knowledge to do that is in the communities, right? And the service providers serve those communities day in, day out. They're trusted by those communities. And so child welfare probation, just like they need to remember now to, oh, wait, we need to go tap informal leaders in the community. We've never done that before. We're child welfare, but we're going to have to start to think about what that looks like if we want to solve this problem. The same way they would be going to the service providers, right, and asking them what they're seeing. Well, why didn't we provide that service to this at-risk family in this case? And the service provider will have an answer as to availability, funding, transportation barriers, et cetera, that can really help. So how does a service provider then get that out into the conversation, right? And so there's, you know, we have to be careful because, you know, and I know that Sonoma's with the way the providers collaborate and the platform that you all have. You have a program that has the providers collaborate. So it'll be, you could use that forum, right, to move. I think it's called Upstream, if you still have it, to move that up into the county conversation. But you just it's tricky because if you get too close, right, then you disqualify yourself, right, from RFPs accidentally, right? So to keep that firewall clean, is there an intermediary, right, through which you can get that information there? In your case, Upstream, and in other counties' case, they aren't as lucky to have that. You would, you know, your CAPCs, like what kinds of conversations are the CAPCs having? Go find your CAPC. And see if they can advocate. That's your Child Abuse Prevention Council or councils, as the case may be in large counties. That's what I'd add. Hope that's helpful, Hector. Thank you.
Thank you.
What else? Other questions? Just, do you see any?
I don't.
Seeing none, I'm gonna send it back over to you to close us out.
Wonderful.
Oh,
Oh.
Oh, no, we were just seeing that Cindy has mentioned some of the work that Humboldt is doing in terms of the CAPC really sort of spearheading this work. So, Cindy, would you like to come off of mute and just share a couple of things that you've done, particularly since you are a county that is a bit smaller than some of the super large counties, and so it'd be, I think, interesting to hear how you're doing this.
Sure. I'll try to do an abbreviated version of what we've been up to. So CAPC, even though, no, it's over here. No, it's over there. No, it's over there. Even though I've got the DHHS logo, I've come on back to work for the county to be able to help get FFPSA up and running. But I retired back in 2011. So 2018, our CAPC said, you know, we really need a prevention plan. We do a lot of good stuff, but we've got to really get, you know, into the prevention work. And so we actually had a huge forum where the groundwork, actually the foundation of our comprehensive prevention plan was created in 2018. And then 2019, CAPC jumped on board with OCAP's efforts to be able to create a prevention plan. And at that point, it was a primary prevention plan. And we went down to San Diego and we linked up with strategies and we met all during 2019. And child welfare was at the table, but CAPC was driving the boat on this thing around creation of a prevention plan for the county. And then we took it into a very much smaller group in 2020 for a variety of reasons, of which COVID was one, and really refined what we needed to have happen in order to be able to create the plan. And that was focus groups. We knew we needed to be talking to families with lived experience, but we needed money. So we sat around and sat around and sat around. And then lo and behold, FFPSA drops out of the sky. And it provides us with the funding to be able to conduct the focus groups, of which we did it through the Family Resource Centers. We have a very large network of Family Resource Centers in Humboldt County. We're very, very fortunate. We're going to use the community pathway. We've got lots of services already in place. We've been doing EBPs since I think they invented EBPs. Honestly, it feels like that at the county level. So it's not like we're recreating the wheel. We're taking what we've got, which are the FRCs. We have 8 federally recognized tribes. We've invited all the tribes that wish to participate, have elected to participate with us. And we've got a really strong CAPC in that we had this foundation for the comprehensive prevention plan. So we're trying not to do too much new stuff with the plan, but after doing the focus groups this past summer, it affirmed what we really were speculating, which was a lot of services, but even people who are actively engaged with their family resource centers simply do not know the breadth of services that are available to them. And then in our county, because we're a large geographically rural county, we got a lot of land and a little bitty tiny group of people. We needed a way to be able to hook families up in all the other areas throughout the county with those services. And COVID helped us. We're going to use technology. Anyway, so I don't know if that was helpful. I hope it was. But
Really helpful, Cindy. Thank you. And I can't emphasize enough. Let me just underline, with double heavy lines, is not needing to reinvent the wheel, right? If you likely have some sort of process that happened that you may not know about, like what Cindy's talking about in your county, where there's data. You've asked folks what they need. They're likely in your target population if you look, and you don't need to do that all over again from a resource perspective and a respect perspective. You asked already, right? You want to come back with some offers on solutions and strategies rather than going, hey, so tell us again what you need, right? In some ways that can be really, really disrespectful. If they already told you 2 years ago, so mental health and child welfare don't talk. That's not their problem, right? They already told one of you. So go back and look for listening sessions. Your sister agencies have had them, your CAPCs have had them. I just can't emphasize that enough, because that's what folks are paralyzed with, I'm finding. Like this, well, but we're going to have to do this whole community-driven process. You might, but probably not. Go look. And then we've got someone, Jeanette is sharing that in Tulare, they started a community engagement meeting with all the CBOs and the other community partners to discuss all facets of FFPSA. And they looked at the resources and capacities and skills that they already had and leveraged those to select programs that would fill the gaps that they have and are feasible to implement. Right? It's a completely valid strategy. Just a couple of caveats, sort of that both of these comments have brought up. One is, I see the A at the end of FFPSA, right? And so I want to always remind folks that you have to be really careful when you put that A on it, because then you're only referring to the 4E funding stream. the federal 4E funding stream that can only be used for EBPs in the Prevention Services Clearinghouse. When you clip off the A, right, and FFPS, that's your whole prevention program that's funded by the block grant, by FFPS-A, and other prevention related funding streams that exist, right? So just be careful with the A, because you'll accidentally perpetuate that all we can do is EBPs in the Prevention Services Clearinghouse. And that's not accurate. Great.
So there is another question, and this question comes from Barrett. Given the current timeline for the CPP and the pending curricula development process, counties may have additional planning to do in order to have robust training workforce development plan. Can the CPP include additional planning activities rather than a fully formed workforce development plan?
Ellie, please.
Short answer is yes. We don't even have our training plan fully fleshed out. So the assurances include a workforce development assurance. So you can have plans in your plan, or you can sign the assurance that you will participate in the state's program, because that is a requirement, and you sign the assurance, and then you're good. We don't expect that those plans will be completely baked. There's a lot that we need to do at the state level as well.
And, everybody's in different places. I imagine you heard Cindy just talk about, well, they've been doing some of this for a while, so they may have a little more to say, right? But another county is just starting, they're sort of upstream, so to speak, in their process, and they'd have to say more plans, like where we plan to, we're going to, rather than we did. And I've been hearing from all of you, Kelly, Cheryl, and Hillary, that is completely okay. Right. Any other questions, Jess? What do we have?
I'm looking, I don't see another
Oh.
question.
Hector has one.
Yeah, I apologize to the group. Kush, when you were sharing the clarification, it was in and out. It had something to do with my Bluetooth. All I heard was federal and state and grants. And I'm assuming that had something to do with FFPS-A, with the A at the end being federal, and then the FFPS without the A joining or being defined by state funding housed in the block grants that we're talking about.
Correct.
Okay,
Absolutely.
did I miss anything, or I just
You
I
didn't.
assumed-
I was just cautioning people against using the A to talk about the whole thing. If you're talking about the whole thing, it's FFPS.
And the good news is this is also recorded, so you'll receive it. Yeah, you can, if anything was missed, you can rewatch the replay, but it doesn't sound like it.
Thank you.
Absolutely.
One thing that we would be interested in as you're working on workforce development, so Caltrans works on training specifically. And one of the things that we would sort of informally like to throw out there as I listen to comments today and some of the comments we've seen in the forums, we know that we have a lot of leadership from across sectors coming to these forums and to these Q&As. And we know from conversations that there'll be a lot of work to do across your workforce. And so I guess we are curious about your perspective on your workforce's current understanding of what is coming with FFPS, and where you view their perspective of their development needs. So speaking about EBPs, but more broadly, as we talk about the comprehensive prevention plans in general for your county, what is your workforce's perception at the moment of where their training and development needs are going to be ready? Or of FFPS in general, what do they know? Or what do they believe they know about it?
Them to come off mute, or do you want to put them in the chat, or both?
Either. We'd be super interested to hear what counties are experiencing on the ground with their workforce right now. We know this is a huge undertaking. And so one of the things that you are doing is building culture and really shepherding people through very large change. And so we'd be really interested to hear sort of what you're experiencing at the workforce level.
We've got a couple of hands.
Sweet.
Cindy and then Jeanette. Cindy, please go ahead.
Thank you. I'm going to be really frank. We are incredibly understaffed. We're down about 40% in child welfare. So we've been really, well, I don't know what the right word would be. Cautious. We've been extraordinarily cautious about discussing FFPS and FFPSA as it's going to be impacting the the workforce here, because we really don't want to make it some, oh my God, now what do we have to do kind of experience. We are going to be training as many as the staff as we can over, and we're going to be doing this over a 3-year period in motivational interviewing. But we're a fortunate county in that we have linkages, we have differential response, we have evidence-based practices. So it's really going to be at the child welfare level more of a constant reminder of these things that are already in place that social workers can be linking their families to as they come into the child welfare system. The flip side is we're doing a lot more with our community partners. They're much more aware of what it is that we're working towards. They're partners in this whole thing. They're way on board with where we're at and where we're going. But again, the caution is so that we're not overwhelming or frankly scaring the pants off child welfare right now.
That's super helpful to us, actually, to hear that perspective. I think we often come at it from a very strengths-based, everybody's going to be super excited to do this, and recognizing that it is a large change when people already feel that stress, I think is important for all of us who are supporting to hear as well. Jeanette.
Go ahead, Jeanette, please. Oh, you're on mute.
Sorry about that.
It
You
happens
think
to the best of us.
I would know how to use mute by now. I think our county is similar to Cindy. We also have staffing shortage, and so we've began messaging about FFPSA and FFPS really early about like just what it was, like just information about what these things are, not anything about like how it will change practice for them or anything, but just like information about what the programs are, what the act is, what it is going to let it go. I mean, we had a lot of really early action with part 4, getting things changed and straightened out with that. And then, so now we're in our CBOs have more information about how FFPS is going to change practice than our staff, because we've worked really closely with them, because we're starting to work in implementing the new programs that we want to use for FFPS. And so because those programs are also going to help add additional resources for the CBOs, because now they're going to get to be able to serve youth all the way up to 17 instead of just serving youth up to 5. And they also are going to, it's going to allow them to continue to use skills they already have that we weren't going to be able to fund any longer once FFPSA started, and like we had to do the full EBP type stuff with FFPSA. We wouldn't be able to, we as a county couldn't afford to continue to fund some of the other programs we have that aren't well supported right now, and we're hoping they become well supported. But but when it comes to our workforce, like in our child welfare staff, we're working on starting to get some trainings put into place to talk to them about what the new programs mean and how they will impact their own work. And we're trying to be respectful of the fact that they're tasked hard right now because of staffing shortages. And so we're trying not to create a lot of work for them, but also say, hey, these are some things that can help you kind of also help engagement with your families and help support you in your journey with your family, instead of making it like it's an extra work for them to do. It's something that they can that they're going to add support people for this family and add a bigger support network for them. And that's the most important thing for our families, but then our staff can feel like they have other people that also can support them in working with this family. So that's kind of where we're going. We're actually this afternoon having a kickoff meeting with our CBOs about some of our programs, and then we're going to be working on, like I said, training for our staff, like introducing the programs, and then also the referral process, and how it's going to be different when it's through FFPS and how it will be different for FFPSA, because obviously like FFPS doesn't require a prevention plan, but FFPSA does. And so how things might look different going across the board and type of things like that. So.
That's really interesting. If I may ask you a follow-up question, and this is, I'm asking Jeanette, but this is a question for everyone. And it's a question I asked 2 years ago, and it was just too soon to ask it. But are you thinking that all the workers are going to do prevention, or there's going to be certain workers that specialize in prevention? Have you gotten there yet?
I think certain units of social workers will do prevention because it's the nature of their work, like our emergency response investigating social workers, probably all of them will do prevention work because it's just the nature of that they're often our first contact. If the family gets to us, which obviously we want to prevent, we're very much hoping that our CBOs are going to be on board with doing a community pathway, because we would really like to do that, but we also want to make sure our community partners are on board with that, because they have the responsibility of writing, later on, we'll have the responsibility of writing a prevention plan for the family, and that's work they haven't done before. So we want to make sure that they're okay with that and they have the support to do that. But with our social workers, it's like some units will be the whole unit, and then I think there will be some programs that probably it filters through by case, like who's like, if you have a family that's had a family maintenance case that needs support, or in our adoptions unit, if we have a family that we're worried about relinquishment or something like that, where those services will be available to them. So there might be some times that no social worker gets to use it, but I think it'll be a whole case continuum. It just will be by case. I mean, the dream is to have whole units of prevention social workers, but that I think is down the line when when we're hoping that this actually does decrease the number of kids coming in, and you can realign your work that way. But I think right now it'll be across our boards as like a case by case type of situation. At least for our county.
It's really helpful. It's really helpful to hear. And others, if there's anything for you're wondering about that, because it's a question you will at some point have to answer in your workforce, is who's actually doing the work. So a question for you all to sit with, and if anyone has anything to add, given what you're thinking you're going to do in your county, be really helpful to hear. And Cindy, thank you for that clarification. You're not being cautious with everyone. You just being cautious with the child welfare staff with regard to change management. So we don't spook folks and lose even more. Totally get it. The one thing I have noticed is that when you do start talking about prevention, at least when I start talking to my students about it, there's this little bit of hope that gets sparked. Just like, okay, like we've always wanted to do that. We've always felt so hamstrung with, all these problems we're seeing, and we know it started years ago. What can we do? So, there is that piece that we could ultimately start to infuse hope into the workforce that is, right now, having some real trouble staying motivated given the pandemic and everything else going on. Thanks for that. Other questions, thoughts?
Oh, wait again.
Go ahead, Hector, please.
Yeah, I'm just kind of trying to get my head around some of these talking points for this upcoming meeting. The offering is, how can we be most supportive. You're dealing with your question about the workforce and, you know, the shortage, the weight around this, the lack of, if you would, individuals to create a team, a prevention team, and on the county level. And so the flip side of that is when you have a CBO that's trying to kind of hone in on some of the specialties that can be provided, then there's the opposite issue. How do we staff up and maintain or sustain that level of expertise and training that's required to then be able to, I don't know, fulfill the need on an ongoing basis, rather than staffing up meets the needs and then it gets shifted to an internal team. So I was just trying to get my head around. So how do you work that out? Is it an RFP that's a long, or not an RFP, but an agreement that's a multi-year, so that you know what you're dealing with and you can depend on the funding? Or, yeah, I just don't have I wondered if anybody else is thinking in those terms.
You know, it is something that one does have to make some effort to get one's mind around. But I think everybody would agree, child welfare and probation especially, right, that we would love it to work where they don't come to us, right? We'd like to work ourselves out of a job, right? So I would be surprised if there was a community pathway established that was working well, and that the county would go, you know what, we're going to take it internal now and have more contact with these families. I mean, I would be surprised if that turn of events occurred. I would see that it would kind of be the contrast to that, which is maybe we, for liability reasons right now, or we haven't figured out how to do safety and risk monitoring and assessments and all that, will start with us. But ultimately, we want to expand our capacity to have our families rely on their communities, because that's the golden ticket in all of this, is to get the communities to rely on themselves, right, and support them to do that. So they don't need system involvement. So, and I would love to hear what other folks say, but I'd be really surprised if that happened, given what I'm hearing.
Thank you.
Yeah, I don't believe that we would, in our county at least, would want to take something away from, if our CBOs are able to do it, we'd be like, more power to you. What can we do to support you to do more work? Because obviously the whole goal of this is to prevent. I mean, it's like, this is the most amazing thing that we can use, funding that was usually only reserved for placement to do stuff to keep kids out of placement. Like, that's amazing. And it's been something that, like, I can't tell you how many years I've been throwing a fit thinking maybe I need to be in the legislation so that I can make rule changes, because that was the only way we were going to get better services for our families. But for Hector, I don't know, because when I happened to be the person that did the research on the programs and made recommendations to my county about what programs to use, but when we looked at it, I looked at all the programs that were currently approved that we potentially could implement, and the ones that we did already have in our county that were implemented, and to see could we expand the ones that we have with the money that we're given, or can we add, and then we also knew that there was a gap in the age group services that we had. So we wanted to be able to pick a program that could serve older kids, because we didn't have anything like that. And but where we started was with what our community partners that already provide services similar to a lot of the programs in the EBPs, and said, hey, they already have the skills to do it. So let's leverage that. Let's allow them to continue to use the skills. They're very successful at it. They're very good at engaging it. We have DR, and DR is very similar to some of the programs when it comes to follow-up and things like that. And so I said, let's just let them use their skills they already have and fund the programs for them to use it. And so we approached the programs. We did have to make an adaptation to one of the programs, and they were open to it, to allow it so that we could have both mental health and our CBOs in that program working. So that was, you know, we did try to keep the initial decision making out of our CBO's hands, other than getting their opinion about what they wanted to do, because we didn't want to mess up an RFP for them, because obviously we did have to go through RFP processes for new programs, and we didn't want anyone to not be able to apply because they got too close to the process. But we did query with them about what programs they were interested in, and then we went forward with that kind of thing. So,
Jeanette, what county are you with?
Tulare.
Thank you. And then the other thing that I put as a note is one of the specialty carve-outs, if you would, is providing services, providing bilingual services and services to BIPOC community as well as LGBTQI. And that is becoming clearer for us in terms of being that CBO that can provide that as an offering.
No, that's really important, because that's both of those populations are hugely, like, you have to talk about how you're going to serve, especially like the LGBTQ population, like how you're going to engage and provide service to them. But obviously, because in California we do have this disproportionality in all of our systems, that you know, serving the BIPOC community is that how we're gonna decrease that disproportionality is important. So that's great that your agency does that.
That's who's in our systems, right? Is BIPOC folks. Other questions? Really, really rich discussion. Thank you so much. Okay. Jess, over to you.
Great. So I just wanted to give a quick reminder. This is a reminder to, I have a couple reminders. Which one do I want to talk about first? I guess the first thing I want to mention to you is that our final series, which is putting it all together, this is the final learning forum prior to the January 2023 deadline for the comprehensive prevention plan, is coming up. And you can register for that now. Thank you so much. You can see it right there in the chat. We have it coming up, and there are some things that will be reviewed. We're going to focus on strategies for drafting the CPP, executing an internal review cycle, and capturing and incorporating feedback. As a reminder, there will not be a Q&A session for this, so we would highly advise that you come in, you visit us. You can sign up there today. And with that, we want to thank you all for your time and for your great questions, and we look forward to seeing you again.